We will have a separate and dedicated Q&A session at the end of the talk. So please wait until the presenter finishes his talk. You can type your questions in the chat box, which will be taken up in the question and answer session. Some of you, we will also give you chance to directly ask the question with our today's speaker, but you'll have to type your name in the chat box so that you can speak directly. All of you, please maintain the online decorum. Do not leave your mics on and go because it's going to interrupt the session. That's all from my side. Thank you so much, and I expect all of you to cooperate by muting your mics and not sharing your screen abruptly in between the session. Please wait till the Q&A session to ask your questions. Thank you so much. Dr. Moshmi, the general round of instructions is over. And from our side, we are all good to start our program. Whenever you have, you can go ahead with.
Yeah, thank you. Yeah, thank you, Shilpa. It's nice that I'm getting your backup from the headquarters. I'll wait for another 1.5 minutes or so that.
Shilpa, can we have these instructions in Hindi also?
Yeah.
Shilpa, can we have these instructions in Hindi also? Because some of the parents might be joining from MHEC or some of the.
Oh, yes, yes.
Yeah, please have the instructions.
Yes, yes, yes. Yeah, sure, sure. I just forgot. Thanks for reminding me. सबको नमस्कार. जनरल इंस्ट्रक्शंस ये हैं, अपना माइक म्यूट रखिए, क्योंकि जब आपका माइक अनम्यूट हो जाएगा तो स्पीकर्स को और सब लोगों को डिस्टरबेंस होगा. तो कृपया अपना माइक को ऑफ रखिए. अपना स्क्रीन शेयर मत कीजिएगा, क्योंकि जो पावर पॉइंट स्पीकर दिखाने वाला उसमें भी बाधा है. तो अनोइंगली भी आप अपना स्क्रीन के ऊपर कुछ भी मत कीजिए जिससे आपका स्क्रीन शेयर हो जाएगा. हम एंड ऑफ द सेशन जैसे ही कर अपना टॉक खत्म करेंगे, सेपरेट क्वेश्चन एंड आंसर सेशन होगा. तो आपको जो भी डाउट्स है, क्वेश्चंस है, क्लैरिफिकेशंस आप पूछना चाहते हैं, आप यहाँ पे जो चैट बॉक्स है उसमें आप टाइप कर सकते हैं. और आप लोगों में से कुछ लोगों को हम अनम्यूट करेंगे. आप डायरेक्टली स्पीकर से सवाल पूछ सकते हैं, बट आप अपना नाम टाइप कीजिए ताकि एक करके क्वेश्चंस पूछ सकते हैं. तो बस अपना माइक म्यूट रखना और अपना शेयर स्क्रीन भी मत कीजिएगा. यही 2 इम्पोर्टेंट इंस्ट्रक्शंस हैं. सेपरेट Q&A सेशन होगा, तब तक आप इंतजार कीजिए. अपना क्वेश्चन जो भी सवाल पूछना है, आखिर में स्पीकर का जब टॉक खत्म हो जाएगा तब हम लोग सवाल जवाब सेशन करेंगे. I hope I'm clear. Excuse me if there are any mistakes in the Hindi.
No, fine enough. I believe सबको clarity हो गई होगी.
Shilpa, help me to know that. Yeah, sorry. Yes, Hemant, carry on.
स्पीकर के लिए दिक्कत होती है और बाकी लोगों को सुनने में दिक्कत होती है, तो ध्यान रखिए कि आपका माइक पूरे टाइम ऑफ रहे, क्योंकि बीच में जब भी आप गलती से भी ऑन रह जाएगा तो बाकी लोगों को स्पीकर की बात सुनने में मुश्किल होगी. तो प्लीज आपसे रिक्वेस्ट है कि आप अपने माइक म्यूट पे रखें और शेयर ना करें. शेयर करेंगे तो भी दिक्कत होगी प्रेजेंटेशन में. Yeah, Mashmi, go ahead.
Yeah, Shilpa, just see that Major Ram sir has joined or not. PV Ram sir, he didn't confirm that he will not join because morning he was just check.
Just give me a minute. I'm just checking.
Yeah, and Shilpa, is our program been getting recorded?
Yes, it is getting recorded. We will start recording the moment we start. All this test check we are not recording. Okay, we will be recording it.
Okay. So another 1 minute to go, then I'll start. Shilpa, should I go ahead? Sir, I don't see any information from sir. So
I think you can
I
start.
think he's.
Yeah. We will go ahead. Huh?
Thank
It's
you.
already.
Thank you.
Yeah.
Yeah, thank you, Shilpa. I'll take this, chance to start. Namaskar to all the participants, respected guest, Speaker of the Day, Dr. Sanjay Kumar Mishra. Just I like to tell about this month, importance of this month. It is a breast cancer awareness month, October. It is also referred in world as National Breast Cancer Awareness Month, and it is an annual international health campaign organized by major breast cancer centers, NGOs, to raise fund as well to give information, treatment, cure, prevention, etc. Cancer, breast cancer especially, this month is referred breast cancer, and we are being celebrating mental health throughout this month. And I must tell you that cancer is still a dreadful disease. It still draws fear in people. Being diagnosed with breast cancer and having treatment can put pressure on our mental health. And in a very recent study, we found that prevalence of diagnosable form of depression in nearly half of the patients who are diagnosed with breast cancer. With this, I take a big opportunity on behalf of National Institute for the Empowerment of Persons with Intellectual Disability, its regional center, Delhi NCR, Mumbai, Kolkata. On behalf of my institute staff, I welcome you all. You have a lovely morning. It is a Saturday morning. It's a restful morning. So I'm sure you all will be giving your, effortful time here in listening about awareness about breast cancer. So I'll be welcoming Dr. Hemant Singh Keshwal, who is Assistant Professor, Special Education, and presently even in additional in charge of Principal MSCC, Noida. Sir, I request you to please deliver the concept note.
Yeah, thank you, Dr. Mashmi. And good morning. And special good morning to one and all.
Good morning, sir.
And on this occasion, I welcome our speaker, Dr. Sanjay Kumar Mishra, HOD and oncologist at Apollo Cancer Center, Bhubaneswar. Dr. Mishra has been kind enough to spare time on this Saturday morning and orient us, create awareness about breast cancer and throw light on the effect of breast cancer on mental health. As you are all aware, cancer itself creates shivers when anybody in our family or known to we come across that somebody is diagnosed with cancer. And when we find that somebody in our family is been diagnosed, then again, not only the family, but also the patient, but also the relatives and the immediate relatives also get affected, I should say, mentally and as well as financially. If they get financially and definitely mentally also, they get affected. But I would like to contribute over here that breast cancer, out of all the cancers, breast cancer is one of the cancer which is curable if identified at early stage. And many of the people have been cured through breast cancer and they are surviving, leading a healthy life. The live example is the host, Dr. Mashmi Bhaumik, who has her willpower has shown and inspired many of us. How beautifully she has recovered in a very short span of time. She is not only an inspiration for all of us to deal with any disease physically, but also mentally. So I not only congratulate her, but salute to her strong willpower, and how she is now a source of inspiration, I should say, for rest of us. Breast cancer, as we talk about, particularly in our Indian situation, women in India are known as Annapurna. They spend their entire life to take care of the family. They take care of their parents, their husband, children, but in due process, somehow they forget to take care, or they ignore themselves, their health, their mental health, their physical health. Not only that, but also the diet. I still remember my mother have a tendency throughout her life, whatever has been left out, she used to eat it. Or whatever is left for yesterday's food, they used to eat it. Forgetting that it might, what nutritional value the food has, they ignore the importance of balanced diet, they ignore the importance of physical fitness, they ignore the importance of mental health. And in due process, when they come across such kind of dreadful disease, the entire family is caught on a wrong foot, but they are not at all aware.
Secondly,
No, somebody's phone is interrupting.
yeah, am I,
Yeah, Hemant, carry
am I
on.
audible? Yeah, sure.
Yeah.
So, what I mean to say over here is that we need to, our families, particularly ladies in our family, needs to be given special consideration, and they should be made aware of.
Somebody's phone. Shilpa, can you? How you?
Yeah, we are checking.
Yes, Hemant.
We are checking.
Yeah.
Yes, someone.
You are hearable now.
Yes.
Yeah.
Yeah, I'm audible. There was some call. Yes. So what I mean, that we need to orient our female members in the family, or brothers and sisters, or people who are around, about to take care, not only to take care of the family members, but also to get regular checkup on on such type of deadly disease like breast cancer, which is curable if identified at very early stage. And in nowadays we have lot of facilities of early diagnosis and prevention. So if we can take care of these measures at early stages and have proper diet, I believe we could be in a position to help out many people in the society to fall or to come in contact with breast cancer. With these words, I conclude my opening remarks, and I hand over to Dr. Mashmi to continue with the session.
Yeah. Thank you. Thank you so much. And now I would request Dr. Sanjay to take his, the platform is his, and he should take up this cancer and the mental health topic. And please make us aware about all the facts which is should be known to everyone, not only female but the male part of the male member of the family. As well, I just want to add, despite Dr. Sanjay Mishra's huge backup of expertise, he is involved himself in taking care of the counseling part of the attender as well as the patient in counseling the depression part of when they undergo. He's been doing parallelly despite his with his major work. He's also is involved in so many physical activity. He just believes that all those positive energies comes from those. He is involved in swimming, running. He's a fitness freak person, and he's very active in all part, whether in social media. And I've seen very rare such doctors who have the all versatility against their beside their profession. Dr. Sanjay Mishra, the platform is here. Please, we want to hear you. Please, you come.
Thank you.
Yeah.
Thank you. First of all, it's a privilege to be associated with Dipanjan. It's a novel work people are doing, helping the mentally disabled people.
We can't hear you. Excuse me, Sanjay, we can't see you.
Okay.
Can you? Yeah. Can you do video?
Yeah. So it's a privilege for me
We
to
can't.
You can't see me?
Yeah, we can't see you.
Dr. Sanjay is in Apollo Hospitals. Please pin
Still you
Apollo
can't see me?
Hospitals. No, we can see you,
My video is
Sanjay.
coming.
Yes, your video is coming, Dr. Sanjay. It's just that it is a little far. So all the participants, you can pin Apollo Hospitals Bhubaneswar, then you will be able to see.
Yeah.
You can go ahead.
Thank
Go
you.
ahead, Dr. Sanjay. Dr. Sanjay, would you like to share the PowerPoint from your end, or should we share the PowerPoint and you will continue the talk? How would you like it? Dr. Sanjay, can you hear us?
Dr. Sanjay is not audible.
Excuse me, Dr. Moshmi, he's muted.
Yeah.
He's muted. So
Yeah, madam. Am I?
Now we can hear you, Sanjay. Please again present yourself again. Yeah.
Dr. Sanjay, you can start sharing your screen.
Let me call and find out.
Dr. Sanjay, please stop sharing the screen once and restart sharing. I think the screen has freezed. If you stop sharing and again restart sharing. Hello?
Dr. Sanjay is taking 1-2 minutes. Yeah, he's taking 1-2 minutes by sharing his screen. Okay, yeah, it is coming. Yeah, present. Yeah, it has come, but yet to come the slide. Let me check. No, are you able to see the slide?
Yes, ma'am.
Yeah, it has come.
Yes, ma'am.
Yes, madam. Slides started coming.
Thank you. Yeah, thank you. Yes, Sanjay, you can start.
Sir, please unmute, sir, your mic. You're muted.
Am I audible now?
Yes, sir, you're audible, sir.
Okay.
You can
Sorry.
start your presentation.
Yeah. So it's a privilege for me to be associated with this group, Dipanjan, and people are helping mentally disabled people and in a national platform. And so this month, it's a breast cancer awareness month. Basically, cancer is curable, and many cancers are curable, but the awareness is lacking in public. So that's why WHO has divided every month to certain cancers, and they have instructed the doctors, the oncologists to do awareness programs and to educate people. What are the risk factors? What are the benefit of if getting diagnosed early? So all these are discussed in a awareness program. So when Dr. Mousimi has proposed me to speak on mental awareness and mental health in cancer and breast cancer, I was excited that it's a new group for me. So let me start with the discussion first. Am I audible, right? Hello?
Yes, sir, you're audible. Sir, make it as a full screen, sir.
Yeah, I'll make it full screen. Yeah.
Yeah, you're audible, sir. Perfectly
Okay.
audible.
So, cancer, the frightening disease and its impact on mental health. A cancer diagnosis can affect emotional health of patients, families, and caregivers because the name itself is frightening. So whenever we disclose the disease to anybody, the apprehension, the fear we can see in their face. So it is it's a very tactful thing how to disclose the disease and at the same time to keep them motivated that whatever benefit, because what we see, the people who get afraid, who get depressed during the therapy, the results are comparatively poorer. So we need to boost their morale. We need to tell them in a way that they should accept the benefit, what are the benefits. And it's a role of the oncologist while counseling, they should give the proper view, the clear view to the patient that they should know what is the plus and minus of treatment and what are the results. And at the same time, need to motivate them to take the treatment properly. So, and the emotional health has to be taken care. And it is always, I always say the patient, it is not only the patient, along with the patient, all family members, their close friends, they all are affected when the patient is diagnosed with cancer. So that experience we see day and out, but probably some of you who have already known people, friends or relatives having cancer, they know the truth. So it's a very tough truth, but I will go through the points where exactly it hits psychologically. So in the discussion, so common feeling during this life-changing experience includes anxiety. Anxiety is the major thing that affects all the relatives, patient and their friends. Distress and depression. So our role being a family member at home, in a school and work where the people are working, and in an office where friends are supporting, that is very important. So it's important to recognize these changes and get help when required. So how anxiety plays a role? Anxiety means feeling uncomfortable. So they feel uncomfortable, worried and scared about the real or possible situation. So whether they are going to lose their life or are they going to be cured, and what can be the toxicities during the therapy. So what all they have to compromise during the therapy because it's a long course of treatment. So all those leads to a lot of anxiety. And it is important to recognize anxiety and take steps to manage or to prevent from getting worse. So anxiety can lead to depression. So we need to intervene at certain point. Either if the person himself can do, fine. Otherwise, some friend, some relative, the oncologist. So I try to relax my patient as much as I can do. So that is my responsibility, I feel. So second thing can be anxiety can lead to depression. So feeling of depression are common in cancer patients and their families and caregivers. So everybody get depressed because they know that cancer is a deadly disease. So we need to counsel them properly in that situation. Along with that, sometimes if patient is very anxious, then we try to hide the real. Suppose the patient has come at stage 4 or advanced stage, we try to disclose the real truth in front of their family and relations and try to hide it from the patient based on their family recommendation that he is not that kind of person who will accept this properly. So let's not disclose with them, and but I need to disclose at least some of their relatives, because without letting them the truth, I cannot go for the treatment. So depression is one major part, and learn how to spot depression. The patient has to learn, attenders has to learn, and we also need to learn how to spot the depression and intervene at the proper time and take proper measures. Distress is an unpleasant emotion, feeling, thought, condition, or behavior. Being distressed can affect the way you think. So feel or act and can make it hard to cope with the effects of having cancer, because once the distress comes, it can lead to a variety of other diseases. So your blood pressure can go up, diabetes can shoot, so your general condition, immunity can go down. So we need to take care of these things and intervene at proper time. So coming to family friends, as I said, cancer is not only the disease of the person, it is the whole family gets affected. So the whole family, friends, all are getting affected. And people in your life may also feel worried, angry, or sometimes afraid. And family members may be very supportive at times, and they may start acting differently towards you, because some people knows that okay, इससे gone case, अभी तो हम इसको ठीक नहीं कर पाएंगे. So why to spend money and emotion behind them? But I don't know whether you people have met with some people. I have seen 2-3 young ladies. Once they're diagnosed with cancer, their husband become totally indifferent. They never came to meet me. They never came to take the counsel. What are the results? So instead of the husband, their father came to me and I counseled them properly. Sometimes they cried in front of me, so they were thinking he's his life partner, but at the crucial time, such a crucial time, they left completely. So this happens. So these things need to be taken care. And that time, the mental health of the patient will be so worse that intervention from family, from doctors is very important. So the people in your life may feel worried, angry, afraid, or sometimes they may be totally indifferent towards you. So some may feel guilty that they are not sick, and that they may feel helpless, that they cannot do anything because it is not in their hands. So they feel very helpless. Now, adjusting to the new situation, once the cancer is diagnosed, the diagnosis is told the patient, when cancer is detected. So daily routine may change for everyone. It's not only the patient, for all the relatives, the daily routine changes. And routine changes around the treatment and the consultant and the toxicity. So schedule may be focused around the treatment. Someone in your family may need to take time off from the work, drive you to the treatment, and perhaps you need for paying the bills or cooking meals nearby. Suppose the patient are getting treated in our hospital, they need to stay nearby for a certain period of time. So someone need to assist them, someone need to cook meal for them. Then coming to changing the roles. When someone has cancer, everyone in the family has to take a new role and responsibility. So that they need to understand what is their responsibility. The child may have to do more course, and the spouse may have to help shop or do a carpool. So it can be very hard to adjust to all these changes. For an instance, I will say that there was a brain cancer when I was in Karnataka. There was a brain cancer patient, and the patient, it was in advanced stage, glioblastoma multiforme stage for incurable. So after even surgery, the patient was completely paralyzed, but he was alive. So we were giving adjuvant temozolomide monthly dose, and After 3-4 months, he requested that, sir, I cannot bring him here to your hospital. I usually don't go to home, but when the emergency is there, I don't hesitate because it is a need for the patient. They requested me, sir, if you can please visit our home. I went to visit their home, and the person was lying completely vegetative, and he don't even move his hands or legs. Sometimes he blinks his eye. So while discussing with a friend, I said he's almost like in his last stage, and he's not moving. He is almost like a dead person. So she felt bad. She requested, sir, don't tell that he is like a dead person. He is still alive, and that gives me so much of satisfaction. So she used to take care of him on the bed, everything, cleaning him, cleaning his stool, urine. But she was happy that he's alive. So people just see the adjustments she was doing. So the family member need to take a lot more of responsibility to make things comfortable in their health. Coming to money, there is a huge financial burden also. So most people find it stressful to keep up with the money matters. So if you are not able to work, the patient, suppose patient himself is the earning person of the family, and if he is not going to work, the earnings get affected. So someone else in the family may need to get a job. So if you and your family may need to learn more about health insurances. We hardly do the insurance, but we don't know whether it covers all the treatment. So how to proceed if the insurance claim has to be done, and if the bread earner of the family is suffering from cancer, then others need to know about the knowledge about the insurances. So find out what will be covered, what will not be covered, what you have to pay from pocket. So all these financial things it's not so easy. It's not so easy. Patient really struggles in these things. So in that case, I being a doctor, I try to help from our corporate team. We have a TPS staff, so I try to help them. So to explain them from the beginning that most of the insurances, they cover everything, but sometimes insurance asks for certain questions to me. I help the insurance people to approve the treatment as early as possible and as much as they can cover. So that help they really need it at that moment. So family members are really not aware of all these things. So they start learning these things slowly. Coming to living arrangement. So people with cancer sometimes need to change where they live, because if their house is far distance of the hospital, if they have some relative nearby or some house nearby, they try to shift there till the time period of the treatment is going on. So sometimes the treatment may stretch up to 6 months, sometimes it may stretch for years. So that change has to be done, and with whom they live. So the relatives may change. So the relatives need to accept that, support them, and adjust to the situation. You may need to move in with someone else to get the care you need, or you may need to travel far from home for treatment. Some cancer hospital typically are not available in all the villages, all the cities. So, for example, in Odisha, Bhubaneswar, Cuttack are the cancer hub. And all the patients from Sambalpur, from Rourkela, they is far up. If you travel by road, it takes 10 to 12 hours. So they have to come far up from the place for treatment. So that adjustment has to be done. So if some relatives are staying nearby, they prefer to stay. Well, radiation is going on probably 30 flex and 6 weeks. So they need to travel every day. So that is a very difficult thing. So they need to adjust with some relatives nearby or take a house. Bring some relatives to stay with them, and those relatives also has to be taught how to understand the situation. So we help certain things, but they also need to understand their responsibility. So these are the difficult things. Coming to the physical change. So during treatment, chemotherapy, certain chemotherapy can induce loss of hair, complete loss of hair, baldness. So in seminoma, in breast cancer, ladies, they'll all lose their hair completely. So that is a very tough situation. People love their hair so much. Suddenly there will be physical change, which is not acceptable to the society. So you can't educate the whole society, but the person and their family, relative, friends, at least they need to support them during that tough phase, tough mental phase, so that they feel comfortable. There are weeks people are using that, but even in weeks there will be change which is significant, and that situation has to. So we need to make them feel comfortable. This is nothing. your hair will grow back, let the treatment complete, you will be completely cured. So that is fine with them, so they should not feel bad. And this counseling has to be very regular, otherwise they will go to depression, they will feel bad. Now coming to the change in shape, suppose a buccal mucosa tongue case has been operated. After surgery, there will be significant change of shape of the face. I will show some pictures where you will find how different they look. Few people look too bad. So, but that's just a physical appearance. The person's heart and soul has not yet changed. So, love, affection from family, from friends, from relatives would not change. Of course, those people who don't know them, for them they may look different towards them. But that has to be understood, and society need to respect them, because they are the warriors. They are fighting with the cancer at that moment. So what we can do can support a little bit morally, so that they feel comfortable. So this is some pictures I will share where this lady with hair and without hair, how significantly different they can look. It's a young kid. In a breast cancer, when the breast is removed, they feel so bad, and that time also they need to be morally boosted. So this is the reason why we try most of the breast cancer nowadays. We are trying for breast conservation surgery. So conserving the breast, taking just the lump out, so that this change will not be significant. Sometimes we reconstruct with some flap, so that both the sides will be absolutely same. So you can see a picture where mastectomy and then reconstruction. So how do they look? So they should not feel bad about that. And this is a picture where a buccal mucosa, pre-op and post-op, this can be the change. And this is just a minor change. If you can see, this is a significant change. So living with this kind of change in physical appearance can be very distressing for them. So for this, we need a lot of counseling, and there are psychological counselor for our patient. They are called psycho-oncology. And this department has evolved since last 5 to 10 years. And in bigger corporate hospitals and bigger hospitals in metro cities, psycho-oncologists are there. So counseling them properly before starting the treatment, after the change, and it is such an important issue. That's why this psycho-oncologists are playing a bigger role. And they can along with the treatment, the mental health part is to be taken care. So how to handle these new changes? Do what you can. You probably can and want to take new things. You can do whatever you can. As much as you are able.
ভেতরে
As much as you are able, keep up with your normal routine by making decisions, participate in the decisions of the family, managing your home, running the errands, and taking part in things you enjoy. So don't stop that. So once you get involved in all these things, your mental stress will automatically reduce. Once you always think of the cancer, what is going to happen, what is the result, what can be the consequence, that can lead to more anxiety, more stress, more depression. So do what you can. Ask for help. If you still can't do that, even if your focus is still on cancer, it's okay to ask for help if you need to. Asking for help is not a sign of weakness, so that people should understand. And most likely, your loved ones want to help you, but you have to open up. You will also ask your doctor about home care and educate family members about the same. So some people, educate people, they ask that home care, how we can take the home care, and how to educate the family, how to deal with those things. We are a little more knowledgeable in those things. We try to do that as much as possible. So gratitude to your caregivers. Cancer and its treatment are hard on everyone, especially the people who take care of you. It is so, staying in a home, spending good time, it's easy for everybody. But think once one of the family members is suffering, your whole life changes. You need to give proper care. You need to give your attention, your time, your fun. With the time where you're doing fun, you have to change yourself completely. So cancer, I believe, hard.
Dr. Sanjay, your voice is not clear.
Should I be louder?
Yes, it
No,
is.
thank you, sir. Yeah. Little more clarity we need. Yeah.
Okay. So gratitude for your caregivers. Cancer and its treatment are hard on everyone, especially the people who take care of you. In normal time, people are really, when they're having fun, it doesn't, it's not a burden on anyone. But when one person suffers in family, everybody has to give attention, take care of the things, and psychologically support them. So it's a tough task. So everybody needs to understand that situation. And when a person, a caregiver is doing their best, the patient can do at least show gratitude for the caregiver. So because of this, they need to have balance in their life, time to take care of personal tasks, errands, rest, and to use the friends. So let them know that you want them to have a break, and that it's okay for other people to take care of you for a while. So many people have feel that why should I trouble my family members, my friends? But that's okay because that's a mutual psychological thing that today we are taking care of them. Tomorrow something happened to you. Definitely, my friend, my relatives will take care of me. So we need to counsel them that it's okay, take a break, and this is the time that we can do something for you. Nothing to worry about that. That's fine. So that kind of counseling really helps. Now, approaches to address the problems. Training in relaxation, meditation, or stress management. Counseling or talk therapy. You need to talk with them for several topics, the topic they're interested with. That can really relax them. Cancer education systems. There are many cancer education systems happening. Or they can go through YouTube also. They can listen them. That also helps.
Dr. Sanjay, sorry to interrupt you, but there is some background noise coming from your end, and the participants are not able to listen to your voice clearly.
This room is completely silent.
No, there is some kind, because all the participants are saying that your voice is not audible and there is a disturbance coming in.
Sir, I think you are from two devices. Are you from?
Yeah, if you can mute the audio of another device completely, just keep the audio of only one system from where you are speaking, then it will be clear.
Okay, now
if you are connected with.
Now is it okay? I am connected with only one device, madam.
Actually, there is some background noise is still coming, sir.
You can keep the device near to you. You are far from the device. So if you could just near to device, or you use the microphone, or you can just pull the device near to you. I think that would make your voice more clearer.
Is it better now?
Yes, it
Yes.
is much better. It is much better.
Yeah, now clear. Thank you. Thank you, sir. Thank you, Shilpa.
Hello.
Yes, you are audible, sir. You are audible,
is.
Dr. Sanjay. Yes.
It is excellent now.
Yeah, it's very nice. Please make it full screen, your PowerPoint, and you can continue.
Hello.
ସୁଜିତ ଆରେ ଟିକେ ଅସୁବିଧା ହଉଛି ଏଠି ରୁହ କଣ କଟି ଯାଇଛି ସାଉଣ୍ଡ ଆସୁନି ଟିକେ ଆମର ଅର୍ଜେଣ୍ଟଲି ଆସିଲା ହ୍ୟାଲୋ
Dr. Sanjay, the sound is very well. I'm able to hear you.
Yeah.
No problem.
Yeah, it's absolutely fine, very clear. Now just share your screen, sir. Just share your screen in full mode. Dr. Sanjay, do you want us to display your share screen from like Nipit?
Shall we share the screen, Dr. Sanjay? Rahul?
Yes, ma'am.
Can you just, Dr. Sanjay, we will start sharing the screen. You can just tell us from which slide you want us to continue and we will share the screen. Is that okay, Dr. Sanjay? Yeah. Dr. Sanjay, can you hear us? Can you say something? Because Dr. Sanjay, you are not audible. Are you speaking?
ଆସିଲା
Ha,
ଟିକେ
now
ଅର୍ଜେଣ୍ଟ ଆସ ତମେ ଟିକେ ରୁହ ସାରିବାନି ହେଲା
Sir, we are
Mostly-
able to hear you, sir.
we are able
Mostly
to
you can
hear
call
you.
him. Mostly you can call him, and because he seems. Mostly just you can just call him over phone. Tell him.
Okay,
Resolve.
okay, sir, I'll just do.
Dear audience, very sorry for the technical glitch. Please bear with us for a few moments. I think we'll be resuming the presentation in a short while as soon as we get connected with Dr. Sanjay. Meanwhile, you can type your questions if you have in the chat box and we will be taking
Hello?
them up.
yeah
Yes,
hello
sir.
yeah
Dr. Sanjay?
I have logged in from my mobile
Okay,
So,
okay.
if you can see the slides then I can talk here also
Yes, yes. Can you see the slide, Dr. Sanjay, right now?
I can see the slide others can see the slide
Yes, yes. Others can also see the slide.
Okay,
You just
okay,
tell
fine.
us next, and we will move to the next slide as soon as you tell next. Okay, and you can
Okay.
talk from your mobile.
No, but the computer is here only. I'm controlling the computer, not issue. So if you can see the slide, approaches to address the problems, that slide is there.
No,
Then
just
you
a
have to
minute.
remove. Then you have
No.
to remove your presentation.
Yeah.
Nipid, you can have to remove your presentation so that Dr. Sanjay can continue with his presentation.
Okay, we will stop sharing it from our end. Huh?
Okay, okay,
Dr. Sanjay, you can now start your presentation.
okay. So you can see the slide.
नो सर एक बार फिर स्टॉप करके फिर से
Okay.
शेयर करना पड़ेगा क्योंकि
Fine.
वो बीच
got
में
it.
हाँ.
Here I have to go.
Stop sharing and again start sharing.
Present now. Your entire screen. Share. So it has come?
Yes, it is coming.
Yeah.
Yes, it has
Yeah,
come.
it has come now.
Fine. So approaches to address these problems. Should I go back again or should I continue from here, ma'am?
You can continue, sir.
Continue
Okay.
continue from here. Yeah.
So this slide I've already completed. So gratitude for your caregivers, because cancer and its treatment are hard on everyone, especially the people who take care of you. So they need to change and adapt to the situation, and at the same time, the person need to show gratitude towards their caregivers, so that they feel good. And sometimes the caregivers need to make the patient comfortable that it's okay to have a break, and that it is okay that other people got some opportunity to take care of for a while, and once he is back, probably that thing will not be required, and they can still have a good quality of life. Ask any other. So I'm doing with my mobile. No. तादरे ऑडियो आसुनी खाली स्लाइड टा प्रेजेंट होइछ. Our IT person has come, ma'am. He's trying to set the thing in the desktop. So just a minute.
No problem, Sanjay. You can continue.
Can you hear me? Can you hear me?
Yes, it is very clear. You can talk.
Yes,
You
sir,
can
yes, sir.
continue, sir.
नहीं सेटा म्यूट अनम्यूट थिला बेले भी बंद हेतला ना ठीक है वीडियो मैं तो स्टॉप कर दूं.
Dr. Sanjay, your mic is muted. Your mic is muted, Dr. Sanjay. Maushmi.
Yes.
I think Dr. Sanjay is reconnecting. Okay. Dr. Sanjay, if you can unmute your mobile microphone, and then we'll be able to hear. Dr. Sanjay, आप बात कर रहे हैं पर आपका माइक म्यूट है.
हाँ नहीं, अभी मेरे कंप्यूटर में प्रॉब्लम हो रहा है मैडम, इसलिए मैं मोबाइल पे
हाँ सर.
ऑडियो मैं ऑडियो मोबाइल पे कर रहा हूँ. देन माय स्लाइड्स आई विल शेयर फ्रॉम द स्क्रीन ओनली.
नहीं, अगर आप चाहते तो हम शेयर कर सकते हैं यहाँ से. हम आपका पावर पॉइंट है हमारे पास. क्या आप चाहते हैं?
नहीं, I will share it from here. He is just restarting once, just 1 to 2 minutes it will be done.
Yes, okay, no problem.
The problem is I cannot hear all your audios. You are able to hear me, but I cannot hear your audios. So he is restarting the system again. Just give me 2 minutes, please.
Yes.
Yeah. So PPT लोड करायचं तुमको WhatsApp रे पठेइतली चलीसी अधारे अछि क्विक करा खोलन. So when I used to counsel, my medical oncologist once told me that Sanjay, तुम्हारे दुम से हमेशा हंसी की आवाज आता है. So how do you make laugh your cancer patients? They are already depressed, and how do you make them laugh? So because from his room, I never heard any smile or laughing. My patient, we laugh loudly because when you get involved with them and जब आप उनको समझाते हो, उनकी problem समझते हो, then you make them laugh. They really understand that, okay, so this doctor understands our problem, and then that वो role बहुत important होता है. तो उनको कैसे relax करना है, उनको कैसे हंसाना है, on small topics also you can make them laugh. So that there the role of oncologist is really critical. So he appreciated that, but he told me after probably 6-7 years of practice, he said, "Sanjay, हमेशा तुम्हारे रूम में से हंसी की आवाज आता है, मुझे थोड़ा jealous होता है, तुम कैसे करते हो ये?" Yeah, it is almost come. हो जाएगा.
By the meantime, Dr. Sanjay, you can take up some questions.
Yes, please.
See, when we talk about people with intellectual disability, females with intellectual disability,
Yes.
by the nature, by the disadvantage of having intellectual disability, they are nulliparous. And nulliparity is one of the major cause of breast cancer.
True.
So, they will remain as nulliparous as the condition prevails with them.
Yeah.
Number one. Number two, the Center for Disease Control have also taken a lot of steps in developing, kind of simple awareness material, how person with intellectual disability can identify, can screen their health problems.
Yes.
And so far, the cancer is not much, been properly placed there, number one. So if your presentation is ready, then we can continue. Then we can have this question at the end of your session. If it is taking time, I can just keep on continuing with the questions.
Yeah, no, it is ready. So you can see the slide, sir?
Yeah.
Okay. So approaches to address this problem, as I said, training in relaxation, meditation, or stress management is very important. Counseling or talk therapy, you need to involve them in so many talks where they take more interest. So that is important to know what is their interest of discussion and to involve them so that they need to divert from the cancer situation. So cancer education sessions are also there; they can help. Social support in a group setting. So, like some people can like walking groups, running group, or some people have team where they come, all the friends come there. So those teams, and there are social support groups in society which is needed to counsel certain group of people. And so that need to help them. And medication for depression or anxiety. At certain point of time, if the depression and anxiety is severe, then that time psychiatric help can be required. And exercise is one best thing which can relax them, because during exercise we release endorphin, which is a positive hormone that keeps our mind diverted from the situation, and at the same time it keep our mood elevated. So that can also be adopted. And what is the role of society and public? Don't ignore them. They are already down with the mental situation of the cancer, and don't ignore them. That is very important. And some people disappear when someone knows to get cancer. So that should not happen. And think before you speak always. Very carefully you have to speak in front of them when you are discussing certain things. And you should not feel them low at any point of time. Follow their leads, respect them, just listen to them. And don't minimize their experience, and don't be intrusive. So these are certain points where we need to learn and focus. So mental part is almost done, and I will take questions later on, whatever Amitabh sir was asking, I will take that. But let me finish with breast cancer, this month being a breast cancer month. So Breast cancer is the second leading cause of death worldwide. In India, it is fourth or fifth, but in India, worldwide, it is the second leading cancer of death. And second most common cancer of incidence increases with age, and all women are at risk. Gender-wise, female, 99% of female get affected, and among the 100% of breast cancer, 99% are female, only 1% belongs to male breast cancer. Age increases with the risk. Age increases, the risk increases, and mother, son, sister, first degree relative, if they are affected, then the risk becomes higher. Menstrual history, early onset of menarche and late menopause. So the hormone exposure period of time is, if it is more, then the risk is more. So those who are getting late menopause and early menarche, the chance of cancer among them, breast cancer, is significantly more. Childbirth, as already Amitabh sir was asking, whether nulliparity is a risk. Yes, nulliparity is one of the major risk factor in breast cancer. And first child after the age of 30 or having no child at all is a significant risk factor for breast cancer. Obesity, particularly in the age around 40, so at the perimenopausal period, is a significant risk factor for developing breast cancer. So diet is very important in that. Diet, exercise, that they play a major role in managing obesity. So lack of physical activity, that can also add to stress. So when you do certain kind of exercises, physical activity, that releases your stress, improves your obesity, and it keeps you healthy in that way. So that reduces breast cancer significantly. And radiation exposure. Some people are diagnosed with lymphoma, Hodgkin's lymphoma, non-Hodgkin's lymphoma. These are the cancer which are diagnosed at very early age, and that time radiation is a part of the therapy. So those who are exposed to radiotherapy at a certain point of time in younger age, they have comparatively higher chance of having breast cancer. Coming to history in family, history of cancer of breast, uterus, cervix, and ovary cancer in family, first degree relative, then chance of having cancer among ladies in those family are more. Hormone estrogen in hormone replacement therapy, the birth control pill, OC, oral contraceptive pill, many people are using. But using oral contraceptive pill for a longer period of time increases breast cancer. So we need to look into the use judiciously. And the last but not least is the genetic factor, certain condition that can be inherited. So I will discuss the genetic factor in detail later on. So what do I need to know? Can I prevent breast cancer? Because no one knows exactly what is the cause. Once the cancer is diagnosed, you cannot affiliate in a particular person what is the risk. I can always tell that these are the risk factors, but for a particular person, I cannot always indicate that this is the risk why you have suffered from cancer. So because no one knows exactly what causes it, there is no sure way to prevent breast cancer. So however, the following may help reduce your risk: maintaining a healthy weight and regular exercises and a nutritious food. This is in our control. Of course, we can do breastfeeding. Usually, with the modernization, a lot of ladies don't want to feed their kid for a longer period, but that's a negative stigma. Breastfeeding at least 6 months or 1 year, 6 months to 1 year, it can reduce breast cancer incidence significantly. Limiting your exposure to estrogen, OC pills, cigarette, and alcohol, they can reduce significantly the risk of breast cancer. Alcohol, we don't think alcohol, our Indian scenario, ladies are taking alcohol, but statistics say 7.5% of all Indian women, they are alcoholic. And to that, the risk is, if a person takes alcohol, the risk of breast cancer is 10% higher than a non-alcoholic lady. So alcohol plays a significant role. Now coming to, because breast cancer is a slow growing tumor, we can diagnose certainly at very early stage and even in pre-cancerous stage if we do routine screening regularly. So what are the screenings available and how it has to be done, I will explain on that. In India, it's not a mandatory thing, but you go to US, you go to UK, they have a mandatory screening procedure. So they follow that regularly. That's why they are getting diagnosed at very early stage. And in urbanized areas in India also people do the things when once they're educated, they do the screening regularly. So I will tell how it helps, how much significance it has. So first is breast self-examination. So a lady can do her own self-breast examination every monthly. Beyond 30 years, after 30 years, in a person with risk of having family history, and in a non-family history person, they can start self-breast examination every monthly after 40 years. Now coming to, and this should be done every monthly once minimum. Then coming to physical examination by a physician. When should you go to physician? Every yearly, you should go to for a clinical checkup by a physician. And as I told, after 30 years in a high-risk family, after 40 years in a low-risk family. What are the high-risk and low-risk family? I will elaborate that later on. Then coming to mammogram. Mammogram is an X-ray of breast. So breast will be kept on a plate and then X-ray will be taken. So that is the simple screening procedure. If you have any doubt or sometimes even physician can miss small tumors that can be clearly diagnosed in mammogram. So this mammogram also has to be repeated yearly once after 30 years in a high risk family, after 40 years in a low risk family, yearly once. So what is the benefit? If you do all these things, what is the benefit? So if you don't do all this screening, the first dot, that is the average size of lump found in a woman. And if you do practice all these screening tests, then probably you can diagnose your tumor at not less than 1/10 or 1/20th of the tumor which we usually get. So that is the benefit, and that changes the results significantly. And we can do easily breast conservation surgery, so those social stigma can be prevented. If the tumors are very small, sometimes we can avoid chemotherapy. And the results are, if you diagnose the tumor at a small early stage, T1 stage or carcinoma in situ, the cure rate is more than 95%. Whereas if you diagnose the tumor in an advanced stage, the cure rate also falls significantly. Even after all the expenses, after all the burden, the results will be low. So that's why screening plays a significantly important role. So coming to the self-breast examination, there are certain techniques. Lie down and put your left arm under your head. Use your right hand to examine your left breast with your 3 middle finger flat. Move gently in small circular motion. You can apply some oil also sometimes over the entire breast, checking for any lump, hard knot or thickening. Use different levels of pressure, light, medium and firm over each area of your breast. Check the whole breast from your collarbone above your breast down to the ribs below your breast. Switch arms and repeat the same procedure on the other breast. Look at your breast while standing in front of a mirror with your hands on your hips. Look for lumps, new differences in size and shape, and swelling or dimpling of the skin. Dimpling of the skin can happen because of the retraction of the skin by the tumor. Next, third step will be raise your arm, then the other arm, and so that you can check under your arm or armpit for any lump. Fourth procedure, squeeze the nipple of each breast gently between the thumb and the index finger. Report to your healthcare provider right away if any discharge or fluid from the nipple. So usually the nipple discharges in cancer are bloody, red color or serosanguinous kind of discharge can come. But if there are other kind of discharge also, please visit your physician. And this is the clinical examination by a physician. Same step what we have we do by self-breast examination. That thing has to be done by expert hand, so that even if you miss, they can detect. So as I told, it has to be done annually for women over 40 years in low risk family, and in high risk family after 30 years, yearly once. This is the mammograph, how it is done. It's a breast X-ray. Now what should be the frequency of screening? I have already told, a monthly self-breast examination, a yearly breast examination by a doctor, and a digital mammogram every year starting at 30 years for high risk category, 40 year for low risk category. Now coming to the genetic association I was talking about. As I said, there are only 5 to 10% of breast cancer are thought to be hereditary. It is caused by abnormal gene passed from family, and it can be either from maternal family or from paternal family. So most inherited cases of breast cancer are associated with BRCA1 and BRCA2 gene mutation. There are 5-6 other gene mutation also, but the percentage is significant in BRCA1 and BRCA2. So BRCA1, what is BRCA? The function of BRCA gene is to repair cell damage and keep breast, ovary and other cells grow normally. But when the gene contain mutation and they are passed from generation to generation, they don't function normally. So the damaged cells are not getting clear, leading to increase in abnormal cell and increase in the risk of cancer. But having BRCA1 or BRCA2 gene doesn't mean that you will be 100% that you will be diagnosed with breast cancer. But women with BRCA1 and BRCA2 mutation can have 72% increased risk of having breast cancer during their whole lifetime. If you say how much is the normal risk without a BRCA mutation, it is 12%. So 1 in 8 women has the potential to develop breast cancer in the whole lifetime. Whereas in a BRCA positive gene, 70 out of 100 means 7 out of 10 lady has the risk of developing breast cancer, which is very highly significant. So that's why genetic counseling, BRCA association has to be detected, and once detected, the whole family member, all the females in the family member has to be counseled, has to be gone through genetic testing. So with BRCA association, breast cancer has more chance to develop at early age. We have seen even 19, 20, 24-year young ladies coming with breast cancer. So this type of young presentation can be highly associated with BRCA mutation. It is not 100% association should be there, but high chance there should be, they can be associated with BRCA mutation. And male who have BRCA mutation have high risk of breast cancer. So if usually the males are found in 1% rate, but once the BRCA gene is found in the family, then males are also, the risk is higher. So once the male is diagnosed with a breast cancer, we need to suspect that there can be some BRCA association in the whole family. So the other family members need to be counseled accordingly. Now coming to the scenario that you have seen a patient, and how do you suspect that this person may be having hereditary risk? Because all the patients are not having hereditary risk, only 5 to 10%. So how to suspect that your family or you have the hereditary risk? You have a blood relatives, grandmothers from either side, paternal or maternal, mother, sister, aunts, either paternal or maternal side diagnosed of breast cancer before 50 year age, because it's the elderly age group cancer. But if they are diagnosed below 50 year, chances are there they may have the BRCA association. So there is both breast and ovarian cancer in the same side of the family, either the same person, same individual at a different time frame, or different person like sisters, mothers, aunts, grandmothers. So other patient, somebody is having breast cancer, somebody is having ovarian cancer. So then you can suspect that BRCA association can be there. And if you have relatives with triple negative breast cancer, this is a typical category of breast cancer where estrogen receptors are negative, herceptin receptor is also negative. They are thought to be more aggressive. So the recurrence chance in this group is comparatively higher. So we need to treat them little aggressively. So if such cancers are there, such category of cancer, then chance of BRCA association can be there. There are other cancers in your family in addition to breast cancer, such as prostate, melanoma, pancreatic cancer, stomach cancer, uterine cancer, thyroid cancer, or colon cancer. These are the cancer where the genetic mutation can be possible. So though minimal, but if multiple such cases are there can be BRCA association in that family. So when in your family having cancer in both breasts, so BRCA gene usually association can lead to bilateral breast cancer. So not necessarily both breasts can be affected at the same time, but maybe in different time frame. But once left and then right, both breasts are affected, then you can suspect that there can be high chance of genetic association. And a male in your family having breast cancer. So there are other genetic BRCA mutations also can possible apart from BRCA, but let's not go to the detail of that. Now coming to prophylactic surgery, it's a new trend which probably started with Angelina Jolie when the one breast is affected and she is found to be BRCA positive. There is high chance that other breast may get affected at certain period of time. So she removed the other breast prophylactically. So this is a viable option, and particularly in BRCA associated families. But this irreversible approach, a very drastic, very aggressive approach. So for that, the patient need to be ready, the doctor need to give green signal, and relatives, friends need to support them. So there's a possibility, but need to be thought of properly. So what they do, they remove both breast and ovaries. So it reduces the breast cancer in these genetic mutated people in the range of 97%. And if you don't want to remove the breast, only fallopian tube and ovaries are removed, then also in BRCA group, the breast cancer risk reduces by 50%. But if you remove the both breast and ovary and fallopian tube, then the risk reduces by 97%. But it's a tough decision, and selected people can choose that. Anything you are talking about, ma'am?
No, you can carry on, Sanjay. Please, no.
So now coming to the management, investigation-wise, biopsy has to be done. So what kind of cancer, whether ductal carcinoma, tubular carcinoma, lobular carcinoma. So what is the type of cancer? Most commonly breast present with invasive ductal carcinoma. There are other cancers like thyroid tumor, malignant thyroid tumor. So based on the biopsy, the prognosis varies. So we need to do a biopsy to prove then immunohistochemistry, whether hormone association is there or Herceptin is positive or not. If hormone association there, it is thought to be good because they respond to hormone therapy, which we continue for 5 to 7 years. And during the hormone therapy, very few people get recurrences. So IHC is very important. Then we need to know whether the disease is localized or it has gone to various parts of body. For that, CT scan, bone scan, and ultrasound is important. If you want to avoid all these tests, one single test is there, which is called whole body PET CT scan, where the whole body, any part of the body is having cancer cell, the color will be changed, and based on the SUV intake, we can diagnose that this part also having cancer. So after that, treatment options, 4 modalities: surgery, chemotherapy plus minus targeted therapy, and then radiotherapy and hormonal therapy. Surgery is the first modality and best modality. Wherever possible, conservation surgery is the treatment of choice. And if not possible, then complete breast has to be removed. But even in locally advanced diseases, nowadays what we do, we give few cycle of chemotherapy, downstage the disease, the tumor shrinks significantly, then we do breast conservation surgery, keeping in the mind of psychological aspect of the patient. And the results are equally good. That's why we have adopted breast conservation surgery. And whenever you are doing breast conservation surgery, it has to be complemented with radiotherapy. So that combination gives equally good result. And coming to chemotherapy, most of the patient need chemotherapy. Beyond stage 1, all patients need chemotherapy. Along with that, if there is Herceptin positivity is there, they need to be treated with trastuzumab, which is a targeted therapy. After that completion of chemotherapy, we need to do local radiotherapy. The gross tumor has been taken by surgery, and the microscopic tumor, they need radiotherapy. In conservative breast surgery, all cases need radiotherapy. In MRMN cases, there are certain indications. I'll explain that. And hormone therapy, those people who are ER/PR positive, they need hormone therapy. Below 40, before menopause, there is another category of drug called tamoxifen. After menopause, aromatase inhibitors are given, letrozole or anastrozole, exemestane. These are the aromatase inhibitors. They are given post-menopausal already. So certain people who are perimenopausal in the age of 45, 46, after 2 years of hormone therapy, if they achieve menopause, then we change from tamoxifen to letrozole. So these are the indication of adjuvant radiotherapy in a complete breast removal cases. Node positive, positive or close margin are the most indicated patient. All cases of breast conservation surgery and can be considered optional in high grade patient, young patient. Young patient, what I have said, because we have seen that the biological behavior, there is a thing called biological behavior, which is not, the test cannot be done with anything. So, but certain people, they behave very aggressively. The disease return very quickly. And particularly in young group, it has been seen that the disease biology is very aggressive. So young patient, we treat little bit, over-treat them. Instead of under-treating, we over-treat them. So LVSI, inadequate nodal dissection after surgery, triple negative breast cancer. Triple negative, as I told, is a little bad prognosis. So we need to add radiotherapy, even if it is not indicated, even the tumor is small. So these are the conditions. Okay. So because I am a radiation oncology, I will elaborate on the technique, how it is different from the older era. With time, there has been huge development in the technique of radiotherapy, with incorporation of modern planning softwares. From Cobalt era, now we are delivering radiotherapy with IMRT, IGRT, arc therapy, and stereotactic RT in certain small tumors. So we can target the desired area of risk and avoid the normal structure like heart and lung from the treatment portal in a breast cancer. In a head and neck cancer, spinal cord, parotid, these things has to be taken care. So we can precisely treat these areas and avoid the side effects. The complete zero side effect won't be there, but a significant reduction, and which will never affect their quality of life. So up to that extent, we can reduce the toxicity. Coming to follow-up after treatment, we don't cut our relation with patient. So they need to come to the oncologist every 2 monthly in first year, every 3 monthly in second year, every 4 monthly in third year, and every 6 monthly after third year, fourth and fifth year. After 5 years, yearly once. So during that period also, we need to counsel them, we need to support them, and chances of recurrence is there. So how you are counseling the patient, you should not make them afraid that you are going to be recurrence is going to happen. You need to counsel in that way that I used to tell that, see, there are this much of chance and you are going by road, there is chance of accident always. So they should not worried about that, and they should lead their normal life. So these kind of counselings are very important. What we do on visits, follow-up visits, clinical examination, PET CT scan every 6 monthly for 3 years. After that, yearly once it can be repeated. So, and this is the TrueBeam radiation machine, which is very precise radiotherapy machine, very high-end machine. And as I told, this is a slide where I have shown in Cobalt era, we used to treat above the red line, the heart and lung, major part of that getting the full dose of radiation. But with the advanced development of treatment, the breast and axilla only gets the radiation. So that reduces the toxicity significantly. And in COVID time, we really maintain the social distancing, the hygiene, and we do COVID test for each patient so that, because all the patients will lie on the same couch. So if one patient gets affected, then chances he may infect others. So we are maintaining our hygiene properly. So that is our responsibility in a way. So my slides are completed. We can have our question answer session.
Thank you.
Thank you so much, Sanjay. I will ask Shilpa, please take questions for Dr. Sanjay.
Yes, sure. Dr. Sanjay, that was an excellent presentation, and we have a lot of questions. And the most important one which I am taking is, I do not know whether it is a misconception or myth, but many a times we hear that wearing inner garments and dark color inner garments while sleeping is going to be risk factor for having breast cancer. Is it really true? Does
No,
the color and wearing it during sleeping, does it really matter in having high risk?
No, madam. No, absolutely not. Absolutely not. As I said, the risk factors are totally different. There are hormonal factors, there are lifestyle factors. So those are the major factors. Wearing in a garment.
Okay, thank you, Dr. Sanjay, for clarifying it. Dear participants, this is absolutely a myth, a misconception. So this is not having any relation, and research does not prove that wearing inner garments during sleeping does not have any high risk factor in having a breast cancer, and the color of the inner garment also does not have any relationship with having a breast cancer. Thank you so much, Dr. Sanjay, for clarifying it.
Thank you.
Dr. Sanjay, we also have one more question over here.
Yeah.
Although you have explained it in your presentation, but our participants would like to have a repetition in sense. How do we do the screening of the breast? Can you elaborate? Can you explain it once again? Because many young ladies, and also because many of our the clients which we deal with are women with intellectual disability, young ladies with intellectual disability. Many a times they may not be aware of doing the breast screening by themselves. So the mothers or the elder sisters would be supporting them quite some time. So if you can just repeat the procedure of doing screening by self once again, it would be very nice.
Yeah, self-breast examination has to be done by the patient every monthly once. After 30 years in a high-risk family, after 40 years in a low-risk family. Low-risk means if the BRCA gene is not associated, or high-risk means BRCA gene is associated, or there are lifestyle changes, there are factors like nulliparity, no breastfeeding, and OCPL. So all these risk factors, if it is associated, then probably they can start at 30 years. And process, as I said, 3 fingers, and either you apply oil or lie down in the position with right hand. They can palpate the left breast for any lump, any disfigurement, any mass inside the breast, and standing in front of mirror, examining the axilla, that if there is any node in that area, and at the same time you can stand in front of your mirror and just examine that if the both breast look same or if there any change in size or shape of any breast. At the end, you can press the nipple with thumb and finger and press it, and you see any kind of serosanguinous liquid or red color discharge are coming. If any other discharges are coming also, then also you consult. Ideally, there should not be any discharge. So if any discharge is there, consult your physician. They can better guide you. But cancer-related discharge color will be either red or serosanguinous greenish color. So that kind of discharges, you can more suspect that that may be cancer. So this is self-breast examination. Once you go to doctor, every yearly once, above 30 year in high-risk family, above 40 year in low-risk family. Doctor also will examine in the same way, but with the experienced hand, they may, if what a patient can, normal people can miss, thinking that this is a normal thing, the doctor can diagnose it. So there are other benign lesions like breast mouse, which is fibroadenoma. So they also feel like same breast cancer, but they will move inside the breast. So it is not fixed, but breast tumors are usually fixed to the muscle and glands inside. So it will not move freely. So that a physician will better determine. And once he suspects, he refers for a mammogram. Mammogram also similarly has to be done yearly once, above 30 year in high risk family, above 40 year in low risk family. So mammogram is a X-ray of breast. So mammogram, they find there are BI-RAD grades, BI-RAD 1, BI-RAD 2, BI-RAD 3, BI-RAD 4 and 5. BI-RAD 1 to 3 are non-malignant, non-cancers. BI-RAD 4 and 5 doesn't mean that you have cancer, but possibility of cancer is there. So once BI-RAD 4 or 5 is found on mammogram, then one FNAC, fine needle aspiration cytology, or a biopsy has to be done to confirm whether this is cancer or not. So if it is negative, repeat the same thing next year, consecutively 3 years it is negative, no need to worry. But because one FNAC, one biopsy can miss the tumor, so ideally we should repeat it. If still doctor suspects it can be cancer, FNAC or biopsy can be repeated. If 2 reports are negative, it is not a cancer. So that's how screening is advised.
Dr. Sanjay, there is one more question. If the mammography states that I have a dense breast, does it mean that I'm already having cancer, or is it only a risk, assuming that there is a risk?
Yes, it is a risk only. It doesn't mean, because many ladies can have dense breast. So dense breast, risk of cancer is comparatively more, but it is not very highly significantly risky. So the risk is in the range of 5 to 10% more. But if there is no lump which is BI-RAD 4 or 5 grade, then dense breast doesn't mean it will have cancer.
Dr. Sanjay, we have one more question on. During your presentation, you while the screening is done, screening should also be done at the armpits. So if we find something in the armpits, a small lump or a small bump kind of a thing, does it also be a concern? Or if it goes away in few days, should we not go for any further testing? When
No,
should be, if the lumps? Yeah, that's
Yeah.
what is the
it can never be a primary because tumor never arises in the axilla. So it can either be a cancer somewhere else and the node is presented there. So it can be a metastatic node only. And 90-95% chance are there in axilla, it can be from breast. So if the breast, once the axilla node is found, then the breast examination is to be done properly. So if there is no lump in the breast and the axillary node is there, it can be inflammatory also. But to be double sure, one FNSC or biopsy from the node is also a suitable thing to do. Because once when I was in Jipmer Pondicherry, one of our teachers, he directly was found to have a bone metastasis. There is a bone lesion and the bone was almost damaged. So they did a PET scan and they found that along with the bone metastasis, there is a very small tumor in the breast, which he also, being a doctor, he missed that. So there's a possibility that tumor being very small, it can spread to other part. So suppose you have missed there is no breast lump and still there is an axillary lump, then also you go to a doctor, examine that with FNSC. And if it is found to be any cancer, ductal carcinoma metastatic, then you have to evaluate the breast properly. But usually what we do, if the axillary node is there, we evaluate the breast first properly so that we should not miss any lump. And then we go for the FNSC from the breast or axillary lump or both the things.
Thank you, thank you, Dr. Sanjay. And this is a question regarding the treatment aspects. Is it always necessary to remove the breast if we are diagnosed with breast cancer?
Surgery is mandatory, ma'am. If you want to cure it, surgery is mandatory, but the breast need not to be removed. And as I said, we focus on breast conservation surgery. The lump only has to be removed with certain margins. And if the lump is significantly big, means beyond 5 centimeter, we cannot do breast conservation surgery. So what we do, if it is beyond 4 or 5 centimeter, we try to give certain cycles of chemotherapy, which reduces or downstages the tumor to a small size, and then we do perform breast conservation surgery. And if upfront the tumor is very small, then we just remove the lump, breast lump and axillary node, and then go for radiotherapy and chemotherapy. So complete removal of breast is not mandatory. But in Indian scenario, people have the stigma of telling anybody that they have a breast lump, and sometimes it may go to certain stage that there will be ulcer. I can show you horrible pictures where the tumor is ulcerated, fungated. That time you cannot preserve the breast. So that time complete breast has to be removed.
Dr. Sanjay, many a times Indian women have this stigma that breast removal is not advisable, or there might be some kind of after health effects by removing the breast, or it could be a psychological stigma. Can you just throw some more light on does the breast removal really affect the overall functioning of the person after the surgery in any manner?
No, absolutely not. Breast removal doesn't affect them, their physical day-to-day activity. It's just a psychological stigma. And if you don't remove the breast, then probably they're going to die of that cancer. And they will not just die immediately. So once the breast, you are leaving that will spread to other part, they will suffer for months, and then probably they will succumb to death. So removal is the best possible way to cure them. So it has to be removed. And breast is not it is not used, and it is not secreting any hormone. So even after removing breast, a lady can lead normal life. But for the psychological stigma, there are a lot of plastic surgery work going on. As I showed in my presentation, one lady removal has been done, and then reconstruction has been done. And there are good surgeons who can reconstruct the breast properly, so to remove the psychological stigma also. Young ladies, they are using silicone implants. I have treated 2-3 ladies whom we cannot differentiate whether surgery is done or not. One doctor from Bombay, my close friend, he has operated one case and they are getting radiation here right now. Only 35 years already. When I examined, I could not find the surgical area also. So people are doing great work. The surgery is advanced.
Yes, thank you, Dr. Sanjay. And now we are coming to a question related to intellectual disability. Earlier Dr. Mishra was also has raised this question. So we would like to go back. Do women with intellectual disability hold a greater risk of, getting affected with this disease? And I would also like Professor Mishra to ask the question once this is answered, because that question was unanswered due to the flow of the presentation. Please, Doctor, do women with intellectual disability hold a higher risk of having, a higher risk for getting breast cancer?
Thank you, Shilpa. I had asked the question to Dr. Sanjay. One is the condition of nulliporous, which is very natural and it will remain this condition, number one. Number two, because the screening is difficult, because of intellectual deficit, they may not be able to perceive some kind of, a lump or something in their breast. So that is another cause of concern. Further, we need to have a regular, irrespective of any complaint, or if any kind of, because NIPID is, organization that is concerned with the health, education, training, rehabilitation, it includes everything. So like if I'm representing Special Olympics Bharat, as you know, we have number of health initiative program for person with intellectual disability. That is Special Smile, that is special dentistry, the dentistry for people with special needs. Similarly, we have opening eyes. Basically, the optometrical screening is different for person with intellectual disability. They cannot, if they don't know E or a Snellen chart, they cannot read it. So for them, we have a pictorial kind of things because it makes sense for them. Then we have a Special Smile. So that is I have already mentioned a special dentistry, then fun feet. So we have number of, and healthy hearing, that's a hearing loss, how it can be. So similarly, since the incidence of cancer is keep on increasing, so what kind of screening procedure can be, developed, which can be used by the caretakers, caregivers, and those with borderline intellectual intelligence also, how they can also explore this and what kind of training can be provided. So if this area can be explored more, I don't want that Sanjay to answer everything, but if these areas can be explored more so that, in India, we can have a resources that would help our particular special population, particularly women with intellectual disability, because the longevity has increased. Because now people with intellectual disabilities are able to live long. So if we can help in that way, that can improve their quality of life, also the longevity of their life. Thank you.
Yeah, this is a very important practical question, sir, you have asked, because we are just talking about the normal people, and what about the intellectually poor people? Right? I have an example. My brother-in-law himself is little mentally, he is still 47 years, but he behaves like a 10-year-old boy. So it is difficult for us to do screening, etc., properly for them. But definitely, we need to help them. Being an institute, probably what you can do, already as you said, they are nulliparous and the risk of breast cancer among them, if you talk about only breast cancer, is comparatively higher, of course. But what we can do, self-breast examination, they will not able to do themselves, definitely. But if you have health checkups regularly, the caretakers can be trained about breast examination, and probably not in a month, at least 6 monthly once somebody can do the breast examination by them, and if some physician come there, yearly they can do the breast examination. And mammogram, if it is available yearly once, at least we can diagnose not in stage 3, 4, at least stage 1 or 2, we can easily diagnose them. Because you know that they're mentally disabled and you are counseling them at that time, you can offer them that this is the standard guidelines for breast screening. So either the family member or you in your institution, somebody can help them in doing screening regularly. So if they don't do cell breast examination, that is the only thing they cannot do. But physician examination in a year and mammogram are advisable, so that can be followed. And at least 6 monthly once, somebody in house or in your center, somebody they can be trained to do the physical breast examination 6 monthly once. That should be good enough to detect early breast cancer, because these are slow growing tumors. They don't immediately come in stage 3 or 4. So definitely you can intervene at certain early stage and you can diagnose.
Thank you, Dr. Sanjay.
Thank you.
Thank you, Dr. Mishra, for supporting and explaining what would be the risk factor and how it can be done. Dr. Sanjay, I just wanted to ask you, I mean, this is not a question from the participant, but I wanted to ask this question on my own self. That is, we do see a lot of screening programs happening for detecting other health conditions and diseases, but we hardly see any screening program or campaign happening for breast cancer or any other cancer related thing. Can you just share from your experience why screening programs are not being taken up at a larger pace on which it has to be gone? Or do you think that our Indian population has some stigma so deep rooted that they do not want to come for any kind of a screening program, and hence they are not being conducted at a large scale or kind of a thing? Please throw some light on this.
Actually, there are multiple factors, madam. First thing, the social stigma is still there. So they cannot come to a common place and do the screening. So, and government has not implemented any standard screening procedure for all females, and it has not been circulated in a government hospital and corporate hospital. So it is the oncologist, the cancer hospitals, they are taking the onus, and cancer hospitals are not in a big number in our hospital. If you compare with the general hospital, in a state like Orissa, there are only 4 or 5 cancer hospitals. So, but for our sake, being oncologist, we do regularly and we do screening camps. In Karnataka, monthly, at least we do 3 to 4 times screening camp, where we go to few places, and in one screening, 200 to 300 ladies. Once we had gone to Belgaum, there is an airport in Belgaum. So the ladies, they're very educated ladies. So first visit, 200 ladies came for the screening. So me and another lady doctor, we examined 200 lady patients there. So there is a social stigma, but if you provide facility near them, probably they're still interested to do that. So everybody, and we detected 2-3 lumps among the patients, among the people, and we sent for mammogram. I think 10 to 12 people we sent for mammogram. So those kind of screening programs has to come up in a bigger way, and probably surgeons also can do, not only oncologists, because oncology number compared to the people in India, 130 crore oncologists number are very low. So only oncologists cannot solve the purpose. Either government has to implement this screening routinely in all government and private hospitals, or even the general hospital, they should come up doing this screening program. We don't charge them, we cannot charge them for that. So it is a service. So definitely people, those who are busy in their schedule, their practice, they are not doing that. But we feel, being an oncologist, our moral responsibility. In this month only, I have done 10 to 15 webinars with different associations with the breast cancer awareness. And we have gone to 1 to 2 places to do the physical screening with them. So this is I just came back to Odisha recently, so my contact here is not that huge. Otherwise, in Karnataka, when I was there last 12 years, in every year, if you say not less than 3 to 4, only breast cancer screening program I have done. And in each screening program, I need to clinically evaluate 10 to 15. Say Rotary, Lions Club, there are certain associations, VRL, Railway, Airport Authority. So with them, I do regular frequent screening camps. So some association need to come forward from their side also. So once the awareness happens, people know. Suppose I educated 50 or 100 people today, they should go to their respective associations, respective friends, and they should educate them that this is important. And slowly people come forward from their side to do some awareness program. We are always ready, and even we are not at, we cannot cover all the places. I can cover nearby places. The doctor nearby your place also, you can advise them to do certain screening camps and can be propagated. But definitely government role is important in this.
Yeah. Thank you, Dr. Sanjay. I have one. I really like the idea that when we were discussing about women with intellectual disability, maybe one of the parents or the professionals who deal with children or women with disabilities can learn how to screen them on a regular basis. I just wanted to ask you: is there any short term course which non-medical professionals can take up regarding screening, which can be used, say for example, there is a special educator or there is a psychologist who often deal with children with special needs and women with disabilities. So do you have any idea about any screening course?
There is no screening. There is no screening course. And there are screening techniques, and they can get it from YouTube or net also, and we can train them. But we need volunteers for that who are doing other works at the same time. They can help in screening. So you can choose a volunteer in your center, and you can train them or take him to an oncologist how to do the screening. And it cannot be a full-time job. So they can just learn it and help them. Yeah.
Yes. Thank you, Dr. Sanjay. And now we have, I would request Mr. Shankar Narayan Iyer, sir, from NIPNID. He said he would like to interact with you directly. Shankar, sir, you can unmute your mic. Thank you so much for joining us. Yeah, you can talk now.
No, the secretary should go to Mosmi Madam only. When I saw in Facebook, immediately wanted to. I'm very happy to see her first. Then I wanted to participate in this. The same time, my wife was diagnosed with cancer, and as a father of an autistic boy, I know the pain I undergone. See, I have not suffered cancer, but my wife was there. My son. Who is a classic non-verbal autistic boy. Okay, so really I come across the pain and everything, and here I want to share one or two things which is very useful to our community, particularly the NIPMD for the past 3 years continuously conducting cancer detection camp, especially breast cancer. Okay, and successfully the next 2nd November we are going to have, and 11th November detection camp going to be held in NIPMD. It's a very proud to say that. Second point, and I have interacted while undergoing chemotherapy with the senior doctor in Cancer Institute. I have interacted. I just, as a layman, I ask you, suppose a treatment, this chemotherapy treatment you want to give to people with intellectually disabled or ADHD, what is the protocol you have? I'm sorry to say, very sorry to say, that doctor was blinking. I don't know, Shankar Narayan, you are telling ADHD, what is ADHD, autism, everything, but I don't know specific protocol. Then I requested Dr. Manigandan to come forward, sir. I'm ready to sit. I'm connect with my professional, and we sit together. Suppose any cancer, anything detected, for people with disability, especially intellectual disability and ADHD. How we can go forward, we don't know. So that I requested that group. Maybe because of Corona, I could not persuade, but I'm going to persuade seriously a kind of protocol. We professional will give input to them, and they doctor will definitely will give some solace to come out from this, because I know the chemotherapy and radiotherapy. My son, suppose I'm not telling anything wrong. Suppose any ADHD or autism, for the male or female, if come up, they have to undergo this treatment now. I personally feel this is a tough job, which we people, our professional and doctor like Mr. Should come forward and do some protocol. With that, yeah, thanks for big opportunity. And again, I'm proud to say that our NIPMD is making regular feature every year. October, we will have a camp, and similar thing. Say it's a collaborative thing with the Indian Bank we are doing, and similar thing we will arrange for NIPID also, NIEPID also. Thank you very much, madam. Thanks for opportunity.
Yes, as Shankar sir saying, it is very difficult, even if you are treating cancer, so chemotherapy with this autistic kids or person, they hardly complain. They will not complain properly. It is difficult to extract what problem they face, what is their complaint. So it is really difficult to treat them.
No, sir. Sorry to disturb you. My son will not complain, but we parents will complain. We parents will understand their pain. Okay. Mostly we are watching what pain undergoing, and we only will say. But we will just fight with doctor. My son may not fight with doctor.
So that is the problem. Means somebody who can understand their problem really need to present that to intervene at right time. So that is very important.
That is why I want to connect my professional with you, sir.
Exactly. And probably sometimes the doctor need to be more involved and emotionally attached to the person so that he can understand what is the problem. And during chemotherapy, there are certain prophylactic medicines are given. So probably such medicines can be used more profusely so that the toxicities should not happen in post-chemotherapy. So that thing can be taken care of, definitely. So that is the role of the medical oncologist comes there. So suppose vomiting chances there is a medicine called fosaprepitant. If they give at the time of chemotherapy, vomiting will not happen. Suppose count fall, if the common chemotherapy side effect is fall in count, which can lead to febrile neutropenia. So for that, we do give an injection which will maintain the count. So probably that injection can be given in advance just after chemotherapy. If you deliver that, so the count will not fall. Still at the end of 10 days, we need to do the blood count properly to see whether the side effects are significant or not. So they need to be monitored more carefully than other normal.
Sir, I'm happy to tell you, my wife has fully recovered and her hair, everything has come. The psychological, mental, this thing has been gone, sir. Thanks for your doctor fraternity. Thank you very much.
Yes. No, that comes actually. The hair loss during chemotherapy, it comes back completely. But only thing is that 6 months, the psychological depression, etc., has to be managed by family, friends. They need to motivate them. Probably you must have supported properly, and that phase must have.
That is a grace, sir. Grace. If at all if it's supported, it's a grace, sir.
Yeah.
Yeah. Thank you so much, Shankar sir and Doctor. We want to announce to the participants that we are coming to an end. If you want to ask any question, please type your question in the chat box. If you want to ask directly the question, please type your name and we will announce. You can unmute and you can ask. While we give time for them to type their name or question, we have one more question, sir. That is, what is the first sign which should ring the bell?
In a breast cancer, the first sign is a lump. There should be a lump in the breast.
Okay.
So many times,
I hope that
they think the lump is normal. So no lump is normal in breast. So any lump has to be scrutinized.
Participants, let us not be ignorant. Let us be a little observant and vigilant. Any small lump, please do not ignore it. अनदेखा मत करो. कोई भी स्मॉल लंप जो होता है उसको आप थोड़ा सा डिटेल में एक बार स्क्रीन करा लीजिए. इट इज good to be aware, it is good to be vigilant than being ignorant and then go to a very critical stages later on. I hope the question is answered. One of the participant was asking, and sir, although you have explained what are the good signs, preventive features, but one of our participants has once again raised this question. Can you please tell what are the preventive measures which generally everybody should be taking in order to prevent the breast cancer?
So related to breast cancer, if you'll ask, first thing is to maintain a healthy diet, healthy balanced diet, maintain weight by doing certain kind of exercises regularly, and quit tobacco, alcohol, and OC pill, oral contraceptive pill, has to be minimized. The use has to be minimized, and around the postmenopausal time, the weight has to be maintained, and breastfeed your kid at least for 6 months. More, if it is up to 1 year, then benefit is still more. And apart from that, the childbearing age. If the first kid is below 30 years, then it automatically gives you protection against breast cancer. So because nowadays ladies are they're equally educated and they're doing jobs, they delay the marriage and they delay the first child bearing age. So that impacts. So we should take care of that.
Thank you so much, Dr. Sanjay. I think that's all from my side regarding the question and answer sessions. Over to you, Dr. Maushmi, for concluding remarks and a note of thanks.
Thank you, Shilpa. Thank you so much. You have taken up all the questions. Thank you, Shankar sir, for the your views and your steps in NIPMED, that is Multiple Disability Institute, and very happy that you will be actually collaborating and helping all the institutes in some way to bring awareness. Dr. Sanjay, definitely, no doubt, you have really thrown up very, very bright and very broad aspects of cancer, especially on the breast cancer. And you rightly said, I like the way you have come your presentation, like exactly when diagnosed, it is called anxiety, then there was ignore, then helplessness, adjusting to the new situation, changing roles of the family members or self, and financial crunches, living arrangements, yeah. Then there is a physical change. And then gradually you move to how showing gratitude for your caregivers, training in relaxation training, meditation, stress management, then cancer related educational sessions and all.
Madam, you're muted.
Sorry.
Yeah.
Sorry. So now you can hear me?
Right.
Yeah, just to tell that you have really covered so well with the mental health coming to the breast cancer level. So I'm very happy to know at least within, see, I have gone through, that is one side, but definitely the help from Dr. Prashant and you was always in a right time. These are the two doctors where I was actually able to contact whenever I can. So while you were informing, I just want to share that I did share my nursery of this chemotherapy with Down syndrome child, with persons with ID, and I interacted the parent. Shankar sir is absolutely right that it is a parent who are, has to take care of children with persons with ID or the females. And it was a boy, but it was breast cancer, it was blood cancer. And truly it is a supportive system for the persons with ID or the one who has to be mindfulness, where we have to be alert and take care that the child's regular checkup, what you have advised even, Dr. Sanjay, and we must take it very seriously. Being a educated person, being right from young time, knowing from my parent, my sister, they all taught me and taught to our own family that how to take care of breast, and all those pattern what you have shown, we have carried out. Despite that, I made a mistake of not taking early care, and I holded it for 2 years, and then I landed for the operation and also. So basically, want to say that, as he rightly said, Dr. Hemant has rightly mentioned that it is female, and the role of female in the family is such a way, weave that they really ignored their health. I will say that I did ignore, and I don't want to, it should further happen by anyone, because it is something, if it goes to high level, you know the result of it. And Dr. Sanjay also spoke about that, how that we need to minimize, that lot of love, sharing, happy sessions to be, created. And frankly speaking, it was very nice that Dr. Lalita was with me, and we used to really chat, laugh, and whole nursery used to see us that what's going on, whether we have come for therapy or it is that fun session. So basically, I'm really, really thankful that you have generated that social support in group setting is very much required in this. And I'm very, very happy that Director Anuradha Dalmia, Deputy Director Major Ram Kumar sir, my officer in charge, Amrita Madam, and now officiating in charge, Dr. Hemant, who has really supported me to take up this, the session or the cause that is breast cancer. And I opted this month because I heard it is to be a breast cancer month. I'm really, really thankful to Dr. Sanjay Mishra, who is very joyful, fitness freak person. He really takes care of his health and spreads lot of information in social media. I was very impressed with him, and he was also a big support to me too. Thank you, Sanjay Mishra. Thank you, Shilpa and Rahul from the technical side, and all my whole team of NIPID, RC, Noida. I thank you, Sanjay Mishra ji, for taking this session. I am hopeful in future also. I'll be very happy to.
Yeah, if
sure.
anybody is not doing any health activity, I will request there is no AS bar. They can rightly start immediately doing at least 5 to 10 kilometer walking in a day, and that would significantly change the health and mental status of everybody. So it's a request to everybody, they should start some kind of activity in the morning or evening. Very advisable.
Very rightly said, very, very rightly said. Very important that we do at least physical activity, maybe at least a walk of, long 5 to 6 kilometers walk is the simplest thing you can help for your body. Thank you, Sanjay Mishra. Thank you, Cancer Center Bhubaneswar, Apollo, for collaborating with us and delivering this very valuable information. Thank you. Thank you, Sanjay. Thank you so much.